So the rolling hills and everything on my drive down here just reminded me of that back when I was younger. So talk about, whoa, hey, why did my screen pop? I'm not sure. Let's make that go away, okay? So everybody in here can understand the concept of that your practice is one big happy family, but it's an evolving family. You have that one brother-in-law nobody wants to speak to, who goes out and sits in the back on the back porch with his beer, you know, anytime you have a family gathering. You have those within your practice itself. Okay? And now my clicker isn't working. Now it's working. That's me. I can give you this presentation. I can give you some talking notes. We do have some handouts available for it if you'd like to. You can reach out to me. Some termination, new hire checklist, those things can help you in your practice as well. Okay? So how does your organization protect itself when you're doing the hiring process? Do you have a disciplinary action? Do you have an employee grievance policy? And these may sound like small issues to your groups. In fact, let me ask you this. What type and size of groups are represented here? Do we have groups with 10 employees or less? Groups with 50 employees or less? Okay? Private practice versus hospital-based groups as well. So, you know, a lot of times when you're involved with larger organizations, there's an HR department that handles some of this. Or there may even be ADP or Paychecks, and they're theoretically handling this kind of stuff, except when you call them, you get put on hold or those kinds of things. So ultimately, HR can end up being your responsibility. So do you have strategies for hiring and firing? Do you discipline, open door policies? We're going to talk about those as how we can apply those to HR situations. So resources. Hiring checklists, firing checklists, employee review policies, checklists for termination to make sure that you're staying compliant, not just from an HR perspective, but even from a HIPAA perspective. I did a security risk analysis for the Walla Walla Clinic, okay? We walked in there, they had more than 200 terminated employees who still had access to their EMR system, okay? Termination of employees and revoking those rights is a commonly missed step in that process and can obviously lead to compliance problems as well, okay? Now, I told you I've done this more than 12 times. If I stand up here and speak, it's going to be about 32 minutes. If this isn't interactive, if we don't have anybody giving me any problems or us working the process through, in bigger rooms, I usually pick on the people at the back of the bus, because you decided to sit there. So, but we'll see how this works, and it's a small group. Hopefully you all know each other, so you should be willing to at least raise some of the issues that you've had within your group and how that works. Okay? So we're going to look at your current hiring and firing policies and how they protect your practice. How are you finding employees? Is that a challenge in this geographic region? I know it has been in every region I've been in. Is there a problem here? Okay, is it finding the right people? Okay, how do you assess what you're doing in the hiring process to make that are leaving you vulnerable? Okay, do you have employment contracts, those kinds of things? And then we'll talk about some scenarios for employee interaction and how you educate your staff and reduce your risk. Okay, but this is something that's in the news. Okay, the MGMA published an entire onboarding, interview toolkit, all of this for their membership because they know that proper hiring can lead to happy employees, correctly hired employees, and sooner or later you're going to part ways with your employees. And doing so correctly can be important too. So is this you? Is this your group? 24 counts of identity theft. Okay? Now, my background is in healthcare IT. Okay? All of that information contained within that health record, the protected health information. And how valuable is that health information and who you're giving access to that health information? You know that health information has permanence. Now, my American Express card, in fact, just in the past year, I travel a lot. You probably heard that. I travel a lot. I've had it replaced twice because I've had fraudulent charges come through. Well, what do? American Express sends me a card the next day, cancels all my charges, takes care of everything for me, and I get a new card. With your protected health information or your medical record, what does that medical record contain? It contains your place of birth. It contains your siblings, your family history. Think of some of the questions that you're asked as part of your security screen for proving your identity. A lot of those questions are contained within your medical record. Where did you live? Where were you born? What street did you live on? Okay? So those kinds of questions have permanence, and you can't replace that information. So giving your employees access to that information and making sure that you're protecting your group. Now, this was an interesting one. Medical employees stole patients' credit card information in Maricopa County. That was in Phoenix. I actually gave this presentation for the Arizona MGMA. This particular individual, they were actually caught. It was credit card information. The man got his money back. But you know whose credit card information they stole? They stole the Maricopa County Sheriff's credit card information. Now, obviously I've had my credit card stolen. I've had my checkbook stolen. Guess what? They said, did you get your money back? Case closed. We're not even going to investigate it. Now, he took off after these people. He found out who they were, okay? Or the practice family, these people were prescription fraud, okay? Writing prescriptions out of Florida. Now, we used to see the prescription pads left in the drawers of the exam rooms. I don't know how many times I've done risk analysis and I just go into open up the exam room drawer and find out that there's an entire stack of prescription pads left for just every patient to pick one up and take one out of them. Because what's happening in those exam rooms? They're not being monitored, right? You leave them, you room them, and you warehouse them. So those are issues that are happening. But this was, again, these were employees, prescription fraud, okay? So one person can set the tone in your relationship, okay, and the atmosphere and experience that they have within that relationship. And that can happen within a family or it can happen within your employee groups, okay? So we're all one big happy family, right? Well, how does your practice evolve? Were all of you hired to be practice administrators? Now, I've been doing this for close to 30 years, okay? I started doing this before there were even PCs. We were using VAX 6000 systems, big, huge pin-fed HICFA printers, okay? And all of those people who were doing claims entry became practice administrators, office administrators. So how many people here have evolved within your own practice? Okay, you become a practice administrator over time, and maybe that has some issues with regards to how your authority is worked or how you interact with your employees, because now you're the administrator or the manager, you're not the billing supervisor, right? So, am I blocking your view here?
No, sir.
No? Okay, so how does that practice evolve, and how do people's changing roles mean that you've got some HR issues? So obviously we want to encourage employees to work it out. Do you want to be involved in every dispute that happens within your practice? You don't. You want employees to work it out, even to the point of coverage, right? Hey, I've already talked to Mary. Mary's okay. Now, do you assume that the employee who says that Mary's covering for you, or do you talk to Mary to make sure that Mary actually says that she's going to be covering for her? Nip it in the bud quickly. Okay? Listen to both sides. Communication is important. We're going to talk about communication a little bit later, but communication is important because that's where the misunderstandings occur, is when communication doesn't happen. Now, you may say you have an open door policy, but do you truly have an open door policy? Are you punitive to people who bring issues to you? Or are your physicians? Is it not just you? You know, obviously, especially if you're in private practice, you got the physician ownership that's managing this. We'll talk about physicians as well. Identify what the real issue is. Okay? Well, Greg's the softball coach. He gets to leave on Friday afternoons early. Always gets to leave early. That's unfair to me. I'd like to go to my kids' games. Well, did you know that Greg comes in Tuesdays and Wednesdays early, makes up those shift times? You know, that's the reason there's hot coffee for you every Wednesday morning, is because he's actually making coffee. You know, make sure that you are communicating. Consult your employee policies. How many people have very distinct policies within their employee manuals? And do they address those issues? And does a conflict result in your ability to maybe create a new policy to address that issue? More than likely, these aren't going to be one-off scenarios. They're going to be recurring scenarios, and if you find that happening, we want to make sure that we establish a policy for that. Now, what's the other issue about establishing a policy? We talked about communication. We talked about making sure that your employees understand and know the policy. How many people have groups here who have employees who've been with them years, but not decades? You've changed policies, but they haven't been educated on what those policies are as policies change. Find a solution. Now, find a solution could also be part of consulting your policy handbook, or writing a policy, or modifying a policy. Write it up if it needs to be. You know, what's interesting is when I talk about compliance, and it doesn't matter just the HR, if you don't document it, what? It didn't happen, okay? So write it up so that you're documenting what occurred, and teach them how to talk to each other. It's about communication, okay? Conflict resolution. In fact, we have conflict resolution coursework for our clients as part of this process. It doesn't have to just be with patients. It doesn't have to be with vendors. It can be employee-employee conflict. And then lead by example. So I had a scenario with a group, and she had somebody who had been there for a very long time. Hadn't necessarily moved up the ranks. She didn't necessarily want to move up the ranks. But everybody listened to this person. She was a front desk supervisor. But she would ferment discontent across all of the employees by spreading gossip everywhere. She would use that as her power to understand where gossip had gone across the office based on what she was spreading. Does anybody have people like this within their practice? Do you have people who, if you have a private conversation, 5 minutes later, that private conversation is spread through the entire office? How do you resolve that? How have you resolved that? Nobody's sharing here. This is going to be a quick 32 minutes here, okay?
Well, one of the things that we've done is we've exercised with the person, and then in the past, there's been times where I couldn't resolve it, and not here, but I had to let people go, because they just keep turning. I'd move them into different positions through my organization, and sometimes I just had to let them go.
And how does that work for you, Gail, when the physician loves them?
It's not easy. It's not easy, because then I've had that where the physicians are very mad. Then I've also had it where the physicians wanted to get rid of somebody, and I didn't think they were that bad. So
well, we're going to talk later about how do physicians need a timeout, okay? Because, right, I deal with a lot of orthopedic practices. In fact, more than half our clientele are orthopedic practices. And orthopedic surgeons have got to be the biggest set on the planet, okay? Even more than cardiac surgeons. I just think that, you know, they like...
It's yeah.
It's a tough one, right? But they're not internists and family practice docs, right? So are you hiring right? So an example that was brought up to me in Connecticut was somebody who doesn't necessarily place ads, is networking, or they're looking for the best person, not the best qualifications. So what's good about hiring somebody who's a good communicator, who's good at customer service, who's a people pleaser? Could be the person who's really took care of you at a restaurant. Hey, if you can work service, you can work front desk at at a medical office, okay? You can usually train some of these physicians if you get great service. In fact, this person carried around his business card. Reach out to me if you're ever looking to change positions. I'm hiring good people. I don't necessarily have to have perfect qualifications. So you're hiring good people, or you're hiring based on checking the boxes on my interviewing process. Okay? And hey, healthcare compliance pros, that's my company. Every employee who works for it is my employee. I have to hire just like you do, and you're hiring the best person, not necessarily the best skills. Sometimes you move people around. We're going to talk about that. So as how you're finding your employees, do you onboard with policy and procedure education? You have a one tear sheet at the back that says, I received this. Guess what? They didn't read it. They just signed it. They took it and stuck it on their shelf, or actually there's probably a little perfect bound thing that they threw into a desk or threw into their glove box, or it got buried under their gym bag in their trunk. Okay? Do you have clear written expectations? Do you have a clearly defined job position with expectations and responsibilities? Or is it, I want you to do what Susie's doing, you can shadow Susie for the next 2 weeks, and that's their training. That's what you're expecting them to do. How are you going to exceed or get excellence? Now, is Susie perfect? Or is Susie going to give the set of skills necessary that Julie has to have to perform her job?
So, I'm sorry, are you saying that we should give their job description to them when we give them their new employee manual?
Their job description should be part of the onboarding process, yes. Okay? You have to set up those expectations. You're not going to wait until you do a 30-day evaluation or a 90-day evaluation to determine what their expectations are. Because what are they going to say during that interview process? You expected me to do these things? Well, Susie didn't tell me those things. Okay? So you're relying on other people. So set up that expectation or do that work ahead of time to establish that job description. Okay? Have a code of conduct and cultivate a culture of compliance. Okay? And that's not just with HIPAA, it's not just with bloodborne pathogens, it's not just with whistleblowing, it's all of that, a culture of compliance when it comes to HR. Okay? Compliance doesn't necessarily apply to medicine, it's just complying with a rule. Well, you need to have rule followers. So you're creating a culture of compliance for those rule followers. Okay? How many people still are calling references? Is that effective for you? What do you call professional references, work references, or personal references? Well, first of all, they're not going to give you a personal reference that's not going to be glowing. I don't care if they got drunk with them last night, they're going to give you a glowing reference if they're perfect, right? What about professional or business references? Do people call you for references? And are you worried about giving negative references versus positive references? So if it's going to be a negative reference, more than likely they're not going to give you that reference. And if it's going to be a positive reference, you're going to be that person who's going to be looking and say, look, I can give a positive reference. Are they available or eligible for rehire? That's your big one, right? Are they eligible for rehire? That's a standard HR tactic, right? So if you're using references, how are you doing that? Are you doing background checks, or are you even checking their social media? Okay, checking Twitter, Facebook, Instagram, finding out what their plans are. Hey, if anybody was looking at my wife and hiring my wife, they would find out that she spent the last 2 months looking for packing and dress lists for a trip to England. Okay? Well, if I'm hiring somebody and I knew that they were planning a trip to Hawaii, I'd want to know that, and they may not tell me that up front. Or we might find out that they've got some extracurricular activities that may pull them away.
I'd like to touch on that if you don't mind.
Sure.
One of the things we found is we started also doing go to the arrest and database, and we found a lot of things that way. So, yeah. I don't know. Has everybody used that? Yeah.
So if you're not, I'm sure Gail would be perfectly happy to share exactly how she's using that as well, okay? But background checks can be effective, okay? And you won't want to find out that he looks like a great guy. He's a convicted felon, but he looked like a great guy.
It was just a drug conviction, that's all it was.
Okay. Opioid seeker? That's what I really want is an opioid seeker coming into my, I go back a few slides and show you those guys, okay? So, do you evaluate your employees early on? Do you allow this to become a problem? Because, look, I just have to have somebody in that seat. And I overlook problems because hirings can be difficult. I know the unemployment rate in Salt Lake City where I'm at, I'm below 3% unemployment. That's basically no unemployment. I have to hire people away from other people. So filling those seats can sometimes lead you to, you know what, I'm going to ignore those problems. But we're going to talk about how those problems can actually turn into positives a little bit. Do you have employee contracts? Do you want, is Washington an at-will state?
Yes.
I don't know. So it's an at-will state. Well, that's great. So is Utah. But I'm still playing unemployment claims because unemployment office seems to be a rubber stamp for anybody who decides to file. Okay? And now the extensions go on. You know, I can document back. Didn't meet objectives. Didn't meet objectives. Didn't show up to work. You know, I've heard horror stories I did this same presentation in Florida. You know, I wasn't told that I couldn't get high in the restroom. Okay? So, do you have employee contracts? Do you have open lines of communication? And are you enforcing disciplinary standards? Are there some people, even in your own organization, that you're willing to be a Trojan horse for you? You know what? I'm going to use Susie. I don't know why I'm using Susie. Is anybody named Susie here? I don't want to. No. I'm going to use Susie as an example in my practice. Okay? I'm going to use her as a disciplinary example because she can take it. She's going to be in on it. We're going to use her as somebody to show that even Susie isn't above being disciplined within my organization, okay, with well-published guidelines. So again, what's the right way and wrong way to hire employees? Now I know that can be a facetious statement because you're saying, hey, I just need somebody to check patients in, okay? If I can't check patients in, I can't see patients. If I can't see patients, I can't bill, and then my doctor is going to be pretty mad because their schedules are empty because I can't see patients. But what's the right way to hire employees? Now, we have a diverse geographic region I see here. I mean, it's all smaller locales, but it's diverse. Do you have problems hiring here in Pullman? Does the college give you people to hire? I'm assuming everybody who's local here probably comes geographically. You didn't drive 2 hours to get here, right? So mostly all. How are you hiring?
People, but
Excuse me?
the college gives you people, but they're students. So if you want long term, then you don't have long term with the college.
But is that the best way to hire just because that's your job pool, right?
Or I mean, that's not your only job pool. If you're not in a hurry, you can wait a little bit and find somebody that is long term and not a coach's wife or somebody that's planning to stay here for a little.
Not a coach's wife? Is that?
Yeah.
Coaches turn over quite often,
Yeah.
huh? Okay. I got to know that. You know, Utah's a Pac-12 school too, so I got to know if your coaches are turning over. Okay. What's the wrong one? Well, and another right way is, are you overstaffing? If you have difficulty hiring and you have difficulty long-term hiring, do you overstaff just from the concept of, I'd rather have bodies when and if necessary, or the physicians push back against that on profitability? Okay? There's always work to be done, though. Hey, I've been a practice administrator. I've managed 3 different practices, anywhere from 50 to 82 employees, okay? And there's always work to be done. It's just a matter of whether we prioritize that work. And we could always use those bodies to get some of that stuff that had been sitting around for 3 years, including all my hard copy PHI that needed to be scanned, shredded, and disposed of, okay? So, are you consulting professionals? And do professionals exist in your geographic region? Do you have headhunters?
I have great difficulty. I transitioned. I ran a therapy clinic, and I I've just transitioned out of the medical clinic, but I deal with a lot of them, and it's very challenging because I've had people say, oh yeah, we're right outside of Boise. No, we aren't.
Right outside of Boise.
Let's pull off the map. That's not where we're located. But I find that even when they interview well over the phone and they tell me they've researched the area, we talk extensively about the region and the rural nature of it. I get them here, and that's when I lose them. And that's been a great difficulty for me. I don't know how much more I can do. I go to my website. Here we send them a community bulletin to tell them about the region. I talk, and I'm from the area, I talk extensively about this is what it's like, this is what we offer, this is where we're located, this is where the nearest biggest city is, this is where this is. And my last 4 candidates I've flown here have all said, I love the hospital, I enjoyed your team, I don't want to live in that area.
And that can be challenging. So if you find good candidates, again, that staffing issue of do you hang on to people who maybe even possibly should have turned over just because replacing them is going to be a difficulty for you, okay? Now, you're going to have different, that's why these groups are so great, okay? This WIMM group, it's supporting each other, okay? Also, if you have turnover, they probably, if they worked in medical, they probably worked for other practices that right? So you're actually bringing people in, full-time employees, you're willing to bring them into this region or to interview and to possibly get hired. That's really interesting. It's not something that I run into a lot. I see that with physicians, even locum tenens, they'll have to fly people in and they see if there's a fit, but I'm not seeing that happen with rank and file employees. So that's something that you're probably facing here that I'm not seeing in other, in Hartford, Connecticut, where I gave this, there wasn't necessarily a lack of people for the jobs. Now, whether they were qualified for the jobs, that was a completely different subject, okay? So in your groups, I see that nobody raised their hand for 10 and under for a number of employees. So your group.
Actually, we have some on the phone.
Okay.
So we have one, at least one.
But your groups are, in general, larger. And when I was doing practice administration, did I have cutouts that separated myself from HR oversight issues for everyday employee issues, like Mary's, again, doing coverage, okay? Or Greg needs to go to a softball game, okay? I'm going to try to remember these names. I'm going to try and not mix them up, okay? So do you have somebody, you have a front desk supervisor who answers to you that's separate from yourself? So you have different levels. Now, the physicians a lot of times use you to insulate themselves from the employees, right? Are you using middle management? I'm talking middle, this is, we're not, 3M. I mean, it's not like you've got, 5 different levels of different management. Are you using middle management to insulate yourself from everyday occurrences, okay? How are you handling those HR functions? And do you give responsibilities to those middle managers, and are you defining those responsibilities? And then you're going to have an open door policy, and then they're not going to like, okay, let's make up a new name, Becky's decision as the supervisor, and she's going to be taking it up to you, right? So we have a changing workforce. Now, there's probably an issue with people who want to come into this geographic region, right? You're probably not getting too many millennials who are saying, I want to move to Pullman, Washington, right? 23, maybe you have great internet. That's, if I've got great internet, I can get there. How do millennials and seniors differ? How does the job description or their job responsibilities? So you use best practices on those assignment of responsibilities. Are you allowing seniors or those in long-term in their positions to do the training of your new staff? Do you use documented rewards and corrective action? How many people actually document their reward system? They know, their employees know what they could earn. A bonus, a day off, a coffee mug. I don't care if it's a hat, with the practice name on it. Do you document that, or do you just hand them out? And does it appear to be random and capricious to the other employees? Well, you really like Susie. She seems to have every mug and every pen and everything else, okay? Or you use documents for corrective action. Think about, has anybody got an example, or think about, fact, when's the last time you had an actual documented corrective action in your practice? Friday? Well, that's good. Today's Friday, so was it last Friday, or was it just earlier before you came in here?
1 week.
1 week ago. Did you actually document a corrective action?
Yes.
A disciplinary action, and you document it. Great. Think about yourself. Are you documenting these corrective actions? And are you documenting your reward systems? Because if you don't document that, how's that going to be part of your employee evaluation? So we have employee evaluation forms that are available for you as well. Okay? Are you putting the right people in the position to succeed? Okay? So are employees playing to their strengths? So you talked about Facebook, we talked about Instagram, we talked about Twitter. How many people have professional versus personal personas for your positions, for your practice? Facebook, Instagram. Is that of any value in this geographic region to have a Facebook account? And do you have a personal versus a professional? Is the doctor maintain his own professional site? Who's doing that? So, are you putting people in a position to succeed? If you've got some millennials who, you know, they seem to always be on Facebook, well, let's give them a reason to be on Facebook. Okay? Let's make sure we're getting the correct disclaimers and releases, but let's put our patients up on Facebook or Instagram. Again, getting correct releases on that, okay? But in a community like this, those could be very valuable for your group, and you're putting the people in the position to succeed. What knowledge does the employee bring to the table? Maybe they were great at conflict resolution. They're a front desk person, so that maybe they should need to bring that to the table. Or maybe there's somebody who, you know what, I have a disgruntled patient, you know what, and I have this. We have a person in our company whose entire position is called Client Success Manager. He is a backslapper, okay? He's one of those people who you could pick up the phone and 2 hours later you're wondering where the time went, okay? That's his strength. He draws people out, okay? He gets us all of our referrals. He gets us all of our references. He even gets our people to do our Google Plus reviews. That's his job. He wasn't hired to do that, but that was his strength. So we used him to play to his strengths. Employees have to understand, know their position responsibilities, and they feel happy when they're in control of their environment. Getting people in positions to succeed. Remember earlier where I talked about we're hiring the best person rather than the best set of qualifications? Are you hiring people and putting them in a position where they can succeed? Or in some cases, are you putting people in a position for failure? Because you know that they're not going to be able to do that, but I just need that body in there. Well, if that's the case, maybe you should document the fact that you're doing that. Have that conversation with Susie. I'm glad there's nobody named Susie in here. To say that, look, you know, I know that I'm throwing you a curveball here. You know, we're going to take care of you long term, but I really need you to be the collections person. I need you to do patient checkout and collections, and I know that that's terrible and you don't want to do it, but I need somebody until we get somebody hired. I'm going to take care of you later, okay? So make people happy when they're in control of their environment. Now, so we seem to be spending a lot of time worrying about negatives. Are we dwelling on the positives? Are you calling people out? Are you using, again, hey, Susie again. Are you using her as a stalking horse to go out and show others positive reinforcements? And have you defined the responsibilities of practice owners, employees on the patient experience? Has that been defined? What their role is, how the patient experience. So you have a lot of this area, based on the fact that it took me an hour and a half to drive down here, it's a very closed network. Everybody knows each other. Do you dwell on that patient experience? Do you want those positive reinforcements? Okay? Are you competing with any other practices for those patients? What are your contracts like with your insurers on your patient population? And everybody can be their own compliance officer if they understand and are onboarded correctly, trained correctly, policies and procedures, reward system, if you've structured this so that everybody understands their role. If people understand their role, they understand how the communication lines work, then it's going to make your job easier. Susie's going to talk to Julie before she talks to you. Susie's going to get her own coverage and then talk to Julie to make sure that Mary's covering for Susie and then talking to Julie. If you've established those boundaries and you've established those lines of communication. Okay? So give me some of your stories. Like I said, it's actually been 42 minutes right now, so we got 10 minutes worth of talking in for my time. Okay? And I didn't even do my jazz hands yet. Okay?
Before you go into that, I wanted to ask you, you said to let the staff know about any policy changes.
Yes.
So what's the best way to do that? And then how often should we be reviewing our policies?
Your policies should be an ongoing policy, because you're not talking about just your employment policies, you're talking about employment law.
Right.
That's changing continuously. And how do those policies affect your other compliance issues? I'm talking about that from a perspective of a compliance specialist. So, for example, how does your cell phone use policy affect your zero tolerance policy on cell phone usage, because you're worried about HIPAA violations and privacy complaints? Okay? Pictures in the office, what have you. Okay? But do you know, under the Fair Labor Standards Act, unless you have a specific emergency contact number for your employees and they're using their cell phone for emergency contact as a caregiver, you can't have a zero tolerance policy for that cell phone. Okay? So you have a zero tolerance on cell phone usage, but it's actually violating what would be considered an HR law. That's where I'm saying that it's not just a matter of having an HR policy and reviewing them. How do your HR policies affect other policies that you have within your group? For example, OSHA policies. You got bloodborne pathogens. Do you have must cover all tattoos with sleeves? Okay, dangling earrings. Okay, any piercings that you're doing. Okay, are those policies that are bloodborne and infection control policies part of an HR policy offset? Or do you have policies for that? So that's where I'm saying that it's a continuous process, and when you do change a policy in another area, you need to look at how it affects your HR policy. The other question about how you do the training, well, that's kind of a loaded question for me, Gail, because I sell an LMS, a learning management system. So policy training is part of our process. But, you know, I remember back in the days before I did healthcare compliance process. Our company's 12 years old. I've been doing this for 30 years. So it used to be, you know, you had the memo where everybody had a little initial line. That's probably not very effective, right? Sending out an email, people ignore emails all the time. I start at the top of the list, hold the shift key down, hit the bottom of the list, and delete everything in between after just a cursory glance to make sure it wasn't, you know, like the IRS auditing me, right? Other than that, it could all go. Because they'll send, you know, Banana Republic's going to send me another email tomorrow. So, yeah, and tell me it's a once-in-a-lifetime 40% off again tomorrow. So, so emails are not very effective. You can have employee meetings. But I'll tell you right now, under penalty of death or dismemberment, 10% of your employee population is not going to show up for some reason. The dog ate my lunch, or my kid's sick, or something. So you've got to have a documented process for rolling those out, and that process should also contain a process for disciplinary action and re-education. Because if you have a failure of a policy, you want to make sure that you've documented on, you retrained them on the policy, you gave them an option to correct their process. Because if you don't do all of that, what's going to happen on your unemployment claim, right? I just dismiss them. You know, it's a right to work, but like I said, it's a rubber stamp. And then you've got wrongful termination suits that can be brought up as well. Okay? So that documentation is important to you on the wrongful termination suit. Healthcare Compliance Pros has actually defended our clients against 32, 33 wrongful termination suits, won every one, because our process documents that training and disciplinary action. Okay?
Yeah,
So,
we have an online program that we use where all of our policies are. We have to review them on an annual basis. Basically, that's the longest you can go is a year. And then you can send out acknowledgements to whatever staff you want, so they have to acknowledge that they read and understood it.
The problem I have is that we will have it in a meeting. I'll hand it out in the meeting, and then I'll send it out by email, and then, a month later, usually it's a physician, will say, I never got it. And, you know, and it's like, great. Yeah. Huh?
Are they signing a form at the beginning saying that they received it?
Oh, they do, but they just leg in. We still say.
Really, the bottom line is you want to make sure that they have the comprehension of the policy, no matter
And
how you do it.
that's what I'm trying to get is I don't know that they are.
Yeah.
I don't know that they are.
so training, policy isn't just handing them a manual, it's actually doing training on what the policy is. We use scenario-based training and case studies as part of our trainings to say, you know, what happened, how do you release information, okay? Well, this is our policy for release of information. That's great. But give me an example. I've got a non-custodial father who comes in and wants to know if his son or daughter received immunizations. Well, that's a whole different level of just, this is our policy on release of information, okay? What information do I have to have? Do I have to have court documents saying that he's allowed to see those kinds of things? So that's a policy education. And whether you're using an online program, I don't know what you're using, or using something like what HCP uses, same process. Employees train annually on every policy, okay? They get the updates, that's part of the process, and we're tracking a lot of other, you know, evaluations, all those things, okay? So, what are you using?
Policy stat?
Yeah. So do doctors sometimes need the timeout? Now you mentioned that your policy problem was your doctors themselves, right? And how do you enforce that, right?
It's difficult. It's very difficult.
So I've done practice administration, as I talked about. Do you sometimes get that physician who's your cheerleader, who's your friend on the board, right? Everybody has it, right? Or you don't? You don't have your friend on the board? Who hired you?
They all did.
You've got to get somebody who's going to be your advocate. I like to call him the cheerleader, okay? If you've just moved, whatever's happening within your practice, there's usually somebody who's the instigator. We need a new EMR system, you know? It's Dr. Smith. Dr. Smith's always the one that pushes that, right? We're trying to save costs. Dr. Jones is always the one that's doing cost savings. And you know who your people are. Now, when it comes to compliance and HR, you've got to find out who your cheerleader is. So, you know, when you have that physician who, hey, I never received this, and it happens again and again, now you've got Dr. Jones, you go, Dr. Jones, can you have a conversation with Dr. Smith and just, you know, we need to, you know, make sure that everybody's on board. But do the doctors sometimes not even work with each other? I've been in practices where the doctors won't even talk to each other, okay? After years of being in practice together, they're practically uncommunicative, right? So how would you handle physician or a physician employee? You talked earlier about your physician comes in and says, Mary's got to go. Got to go. It's got to be out of here.
I haven't had it here, but I've had that in the past.
And if you haven't had that, you're probably new, because that happens. You know, the doctors are the smartest people in the room, of any room that they're in, right? And you know, Mary's got to go. And then tomorrow, when Mary doesn't show up for work, they're actually worried. Why isn't Mary here? Well, Mary went home crying last night.
Yeah, exactly.
Okay, I'm hoping I can even retain Mary. Okay, do doctors sometimes need a timeout. So when you talk about that physician cheerleader and establishing a relationship with your board, I'm assuming your board is made up generally of your physicians, okay? Or the majority of your physicians, or maybe you've got one, hey, I've seen it. You got that senior physician who's just sucking on everybody else's billings too. But that's stopped happening a lot. But you've still got the physicians on the board. Do the physicians allow you to be the HR manager? You've got to establish that relationship to protect the physician. Look, if there's a harassment, you don't want that employee to be filing a harassment suit against your physician. Now, I deal with the compliance all the time. The doctor is, that's not going to affect me until it does. And then you're the person who's in trouble because you didn't do your job, right? Even though the doctor didn't let you do your job, you didn't do your job, okay? So make sure your physicians are on board, or at least start having those discussions about protecting them. Now, a lot of physicians don't want to be involved at all. Hopefully you're lucky. They just, hey, I want to come in, I want to see patients, I want to leave. Okay. So we talked earlier about the poisonous employee who's spreading rumors. Anybody here got a story about a poisonous employee that's ruined your practice? Or everybody's been happy, or you just let them go? You have those employees who come in and spread dissent, rumors, backbiting in your groups.
I just started there, and there was a lot of that going on with certain employees, and I called them in and I told them about, you know.
Did you look at my second slide with the nip it in the bud? Yeah, you can't let that grow, or they become emboldened because of the fact that they haven't been disciplined, right? Now, if you got one already, how are you going to handle that? You're going to create a policy. Hey, if we find out there are rumors, we have a policy on rumors. I mean, you could get that specific with your policies, especially if you're facing a specific issue for your group. And then make sure the policy is educated out to your employees. And guess what? If you're creating a specific policy to deal with a specific situation, the people who that situation applies to are going to get the message. We hope. Gail doesn't look to it.
No, I've had some of them that they are either very in denial and it's not them. I'm sure everyone will have that. I mean, you know, I've gotten to the point where I've actually got through I do the three tiers of disciplinary action, and got them to where I'm firing them, and then they still turned around and they were shocked. They were shocked that they were being terminated. And I'm like, well, we've been in here 4 times now, and yes, you're going away. So yeah, sometimes I don't think they always get it though.
Yeah, I've had that same thing happen. You know, we just met 2 weeks ago. We laid out this game plan for you. None of that happened, and then you let them go.
Yeah.
You know, I had a great example in Arizona. The woman said, her letting them go phrase was, I'm going to let your star shine somewhere else. Okay? That was her phrase. Okay, you like that? But here's the great, but what her employee who didn't get the clue, she came in and said, well, where are you moving me?
Yeah.
You know, it was, oh, great. I get to move to, you know, to Peoria? That's my new office? Yeah, I get a new assignment? But, you know, again, it just depends on who your person is. That letting your star shine somewhere else may not be effective for that person who just doesn't get the point. Okay? But timely corrective action and how you're dealing with it. Okay? Whistleblowers. Now, this doesn't have to be a fraud, waste, and abuse whistleblower. How many people do fraud, waste, and abuse training with their employees on Stark, anti-kickback, all of that stuff? Okay? But it doesn't just have to be fraud, waste, and abuse. It could be any whistleblowing that seems to be bringing things to your attention. But do you have policies that are going to protect the employee and the practice from whistleblowers? Audit logs. Now, everybody says, I got audit logs. How many people actually look at their audit logs? How many people have seen, well, you know, Susie was in this patient's chart. Are you looking at that at a private practice level? I'll tell you right now, for the practices that I did administration for, if employees got into charts on the hospital system, the hospital would start emailing me, start emailing my physicians. They're looking. And you need to treat your practices a little bit more like a corporation rather than just a loose amalgam of private practice physicians. Because as far as the government's concerned, you're a professional corporation, right? And you have retraining and policy and procedure reviews. I can't stress that enough. You know, Gail already brought that up. What's the best way to do policy and procedure review? What's the best way to do retraining? Document. Okay? Have the procedure in place so it takes it out of your hands. You have policy stat. Okay? You get HCP. Automate the process so you're not having to go. Has a year gone by? Because what happens is a year goes by and you're like, did a year go by? Did I do the things that I was supposed to do last year, this year, every year? Are you tracking all of those different little metrics? Okay. So with firing, do we retain, retrain, or say, I'm going to let your star shine somewhere else? Okay? Is it a culture fit issue? Do you retrain? Now you have a limited group of employees that you can pull from. Do you find yourself retraining? You put people in a position to succeed? Are you finding people in your new position where you're like, you'd probably be better dealing with pre-auths than dealing with check-in? You know, you're not really a people person.
Right. Sorry.
I need you on a phone. Okay?
I don't want them to see.
You know, you've got a face for radio, right? Okay. Right? But they seem to love working with patient check-in, and you're like, you're really not succeeding at this, right? How often are you evaluating that before it's too late? And again, is there a social contract within your office? And do you put these processes in place for firing? Okay. Do you use a termination checklist? What is it? What is on your termination checklist? Give me an example. EMR. Okay.
Turning in their.
Well, as a HIPAA professional, yeah, I see the EMR. Okay, what else?
Turning in badges.
Turning in keys.
Everything. And then if they, you know, if they need any benefits sent to them, and then all of that. So I have somebody take care of that for me.
Okay. And you make sure you're checking that termination process, right? I have a termination checklist, but I get most of it done.
No, I would never do that.
You don't?
You have to
Make
go
sure
through
you
the
check
checklist.
all the boxes, right?
Otherwise, it's.
How do you resolve any outstanding issues? Making sure the employee's notified of their benefits transition, right? Okay? How do you protect your practice against HIPAA? Making sure that they're, and it's not just the EMR. It's, do they have access to your, you know, your email, your shared drives? Do they have hospital access that was granted to them based on them being an employee to get to chart documentation? Do you notify the hospital?
You also have to notify your staff so that everybody is aware that person's not supposed to be back.
How many groups here have multiple locations? I know there's this. So you have multiple locations of service. So you're making sure that every staff at every location of service is notified that somebody's been let go? Or how many people we're trying to make this as quiet a transition as possible. So we're not letting people know that this is happening. Yet they can walk into another facility, maybe the PIN codes haven't been changed on that security door at the other facility that they knew about. Okay?
One of the things we struggled with on the email side is when to terminate their company email. Because some people, I don't know what would be an example of. Somebody gets married and their spouse moves, they were a great employee and they loved us and it was a family, and then, you know, they want to, pen something to the group about how wonderful their experience was and all that, which you like to see. But then there's some others who, you know, their parakeet got murdered and, you know, the world's against them, and no matter what happened, even though they left of their own accord, their parting shot, you know, you really don't want out there. So we've struggled with, when do you terminate the email access?
Okay, so one of the things that's happened in my line of work back in the day when I was doing IT services is your IT people, they didn't get fired at work. They got met at the door before they got in the building. They weren't even allowed in the building. I could take your network down in about 30 seconds, okay? Ransomware, all those things, I could just destroy you if I really got upset. I understand the implications of trying to be nice about it. My situation would be to terminate and forward that email. You're not going to terminate the email because I don't know what you're using your email for. If there's any communications that are happening, if you're using an encrypted email system, they may have outstanding emails that are coming in that are being triaged possibly. Generally forward those emails immediately. And if they want to write a great email to the staff, go ahead, send it to me. I'll be happy to circulate it to the staff for you to let them know your feelings on, you know, that. And it can be tricky, especially if you don't want to upset a staff member who may come back at some point too. You know?
Well, or they're, you know, not a superstar, but not a dud either. They're just an employee.
Yeah.
And they gave a 2-week notice for, you know, some random and acceptable reason. They were going to go work somewhere else or whatever it is. And so you can't shut their email off immediately and let them sit there for 2 weeks with no email and expect them to work. But you don't know, as you get closer to the separation date, what they're going to do.
You've got to evaluate what your exposure is. I've seen people who, you give your 2 weeks notice, we'll pay you for 2 weeks and leave.
Yeah, well, we've done that.
Yeah. Because, look, I can't afford the exposure of what you may or may not do within this group. Right? So you're going to have to look at that probably almost on a one-on-one basis. Now, your policy could actually be somewhat vague. You know, we're going to terminate your employment based on the needs of our group and terminate your access to our systems based on the needs of our group. And you could leave that vague. That way you've got an enforceable policy, but you can look at how that employee interacts, what their general demeanor is, whether they may be retaliatory against you as an employee or employer, those kinds of things. Okay? But it depends. Have you had exposure issues where somebody's gone out and blasted the entire company? No.
In 30 years of doing this, hell yes.
Okay. So yes, then you're probably saying, look, I'm sorry, Susie, but you know, we're going to terminate your email. You know, I'm not worried about you, but you know what? I've been doing this for 30 years, and this is just the precedent that we established. But when we talked about communicate that, look, it's not about you, Susie, it's about our policy, okay? That can also make it so that you're not the bad guy. You know, I have a policy. You were educated on that policy. When we terminated you, I let you read the policy. This is the way we do it, okay? So again, you're not the bad guy. Because as soon as you turn into the bad guy, then Susie does want to blast the entire company. She wants to put a sign out on your front lawn saying, you know.
Well, and I agree with all that. And I'll give you a little background. We use strength finders to assess employee strengths so that we're not pounding, you know, square pegs in round holes.
Yeah.
And one of my top strengths is called WOO. I'm a people guy. Okay. And so when you start talking about, well, you need a policy, put the policies first, that runs against the whole concept of being a family and having, you know, the relationship with people. And somewhere you have to find that balance.
Yeah.
Because you can't function without policies. I get that. But you can't, in world according to Jeff, you can't run around behind the policy all the time. The people have to come first. We're in a people business.
Yeah, and I'll tell you right now, with the advent of the EMR, it seems like the doctors aren't even people anymore.
Right, oh yeah, no, that's one.
My biggest complaint that I run into with the doctors is, the doctor didn't look at me, he never touched me, okay? He sat there and typed at his keyboard the entire time. Yeah. So.
We had a patient file a complaint with the Board of Medicine. We function mostly in Idaho.
Mm-hmm.
Because the physician documented a physical exam and the patient alleged that the physician never touched her. But there's no requirement anywhere on a physical, I can assess you physically without touching you.
I can do a full review of systems and.
Yeah.
Theoretically, but.
And to me, that was caused, obviously from a lack of relationship between the physician and the patient, but that thing you're just talking about, that the physician didn't come across as even being human.
So, I know this isn't talking about this, but are you moving into scribes? Have you moved into scribes as that, you know, I got somebody who's going to type, and I got somebody who's going to actually talk to the patient, okay? By the way, do scribes actually help your reimbursement anyway? Because they're going to get that fifth problem that's going to give you a 214 instead of a 213, and they just paid for their entire day's salary on an upcode, or a couple of upcodes for you. So, yeah. Completely off the top. Okay, so HR. It is hard, but I deal with 13,000 practices all over the country that are clients. Yes, you have to do a broad brush. Policies have to be in place. How regimented the policies are, but the education of those policies are really the law of your practice.
It's the foundation.
Yes.
Sure.
Okay. All right. Hey, have you seen how the government publishes laws? They publish laws and then they don't define them. And then it's up to the jury and it's up to the judges and it's up to administrative people at every level. You know, you've heard that same saw, you call 3 different IRS people, you get 3 different answers to the question. That's the way the government works. So the policies can be fairly open, but everybody has to understand, have the same base set of understanding, okay? So, well, hopefully this had some value to you. I went over 32 minutes, so we actually had to have some interaction, okay? I do have those new hire checklists, employee evaluation processes, termination checklists. If you're not using one, or if you'd like to see if you're missing some steps, go ahead, write to me. I can answer my own email, okay?
You don't skim it and delete everything in it?
Hey, I have a public persona and I have a private persona. If you look at my phone, I actually have 8 email addresses on my phone.
What was that email again?
Eric at hcp.md. That's the easiest.
Handouts or some,
I have some, I don't have the handouts because they're in PDFs, but I can share them with you. It's termination checklist, employee evaluation forms, and new hire checklist to make sure that you're doing those things. And again, even if you're using one, take a look at it, make sure that you're not missing a step, or, you know, you can tell me my form sucks, so I'll take that personally. I'll never come back to Pullman, Washington, okay? And lastly, you know, we got Policy Stat, Healthcare Compliance Pros. As supporters of your group, we'll do a compliance evaluation, including HR compliance evaluation for any of your groups for free, okay? Just come up and see me. I've got an evaluation, a card that you can just get an evaluation of what your policies are. We'll do that for you for free, okay? So there you go. Now's the time to discuss, or not discuss, or any other questions? I can go back to my question. All right, well, thank you.
Thank you.
thank you for those on the phone.